to be your nurse practitioner today, and I'm going to be doing a neurological assessment. First, we're going to start off by testing the cranial nerves. So I'm going to start off by testing your olfactory nerve, your sense of smell. So I'm first going to have you clear your nasal passages by plugging one side of your nose and blowing out. All right, now do it on your left side. Great. Now I'm going to have you close your eyes, and I'm going to bring a scent close to you, and I want you to tell me when you smell it. So I'm going to start by having you plug your right nostril and bring this closer to you.
Now.
Okay, now go ahead and plug your left nostril.
Now.
All right, very good. Your olfactory nerve is in check. So next we're going to do your vision assessment. So this is testing your optic nerve. So I'm going to have you, with both eyes open, read these series of letters.
N-E-U-R-O.
Great. Now I'm going to have you cover your right eye and read that same row backwards.
M-A-X-E.
Okay, and next I'm going to have you cover your left eye and have you read this series of letters.
G-U-I-D-E.
All right, great. The next thing that we're going to do is I'm going to assess your peripheral vision by wiggling my fingers, and I want you to tell me when you see the fingers come into view.
No.
All right?
No. No.
Okay, very good. I'm going to have you cover your right eye. I'm going to do the same thing. Let me know when you see my fingers.
No.
All right, now cover your left eye.
No.
All right, very good. Next up, I'm going to check your pupillary response, so you're going to feel a bright light in your eye. All right. All right, pupils are two, equal, and reactive and brisk. All right, next I'm going to have you follow my light to your nose, okay? Try not to move your head or anything, just use your eyes. Very good. Same thing, don't move your head just follow with your eyes. All right, very good. All those tests are testing your oculomotor nerves in your eyes. So next I'm going to do your facial muscles and kind of assess those nerves. So the trigeminal nerve, I'm going to have you flex your teeth. Good. Clench your teeth here. Very good. Very strong clench. Next up, I'm going to take a swab and I'm going to touch different areas of your face. And I want you to tell me when you feel it with your eyes closed and where it's at.
Forehead. Forehead. Chin. Cheek. Cheek. Chin.
All right, very good. Next up, we are going to do some facial nerve assessments. So I'm going to have you raise your eyebrows up. Now I'm going to have you bring them down. Close your eyes. I'm going to try to open them. Don't let me open them. Okay? Now I'm going to have you smile at me. Smile at me without your teeth. Now frown. And now puff your cheeks out. All right, very good. Everything is equal and symmetrical. That's very good. All your facial nerves seem to be intact. Next up, I'm going to test your acoustic nerves. So this is what helps you hear. Can you hear this when I do this? Okay. I'm going to have you close your eyes and tell me what ear I'm doing that in.
Left. Right. Both.
All right, very good. The next step, we are going to have you open up your mouth wide and say ah.
Ah.
All right, the vagus and soft palate rise equally, very symmetric. And then next step, I'm going to have you stick out your tongue and move it left to right. All right, very good. It's your cranial nerve 12, hypoglossal, and your speech seems to be very clear. Next step, I'm going to just test your spinal accessory nerve. So I'm going to have you push up on my hands, okay, bring them down. Next up, I'm going to have you turn against resistance. If it brings you any pain, I want you to stop. Go ahead and turn to the left, good. Turn to the right, good. All right, that completes our cranial nerve assessment. Next up, we are going to be doing a coordination exam of your upper extremities first. So I want you to do this on your thighs. All right, as fast as you can. Okay, very good. Next up, I'm going to have you point. I'm going to point my finger here, and I want you to point it to your nose. So I'm going to have you go finger to nose. All right, and now I'm going to have you do it. Same thing with your left hand. All right, next up, we're going to test your lower extremity coordination. So I'm going to have you kind of lift up your legs if you can, and then pat on my hands rapidly. All right, very good. Next up, I'm going to have you take your heel down your shin. Good, and now same thing with the right leg, or on the right leg. All right, very good. Coordination seems to be very good. Are you okay to stand up today? Okay, I'm gonna have you stand up, and I'm gonna have you just walk with your normal gait toward, yep, there we go. Now go ahead and turn around and walk on your tiptoes. Very good. Now turn around again and walk on your heels. All right. Now next I'm gonna have you do kind of a tightrope walk with heel to toe. All right, very good. Now while I have you standing, I'm gonna do a couple of exams that kind of test your balance. I'm gonna have you squat down into a squatting position. I got you here for support. Okay, now stand up. Do you feel like you could hop in place?
Yeah.
All right, go ahead and do that one time. All right, great. Now I'm gonna have you close your eyes with your arms at your side and try to stay as still as possible. This is gonna be about a 20 to 30 seconds assessment for this one. All right, I don't see any swaying. That's a really good sign. You can open your eyes. So that's a negative Romberg sign. That's good. Next up, I'm going to have you hold your arms out like you're holding a pizza, and I want you to close your eyes and kind of do the same thing. All right, I'm not seeing your arms drift or anything. You have equal stance, not wobbly or anything. You're going to feel you push your arms down. All right, good. You can go ahead and sit back down. All right. Next up, we're going to test your upper and lower extremity strength. So I'm going to start by doing your elbow strength. So I'm going to touch here, and I want you to push up against my arm. Good. Now push down. All right. Now we're going to test your wrist. Make a fist. Now push up on my hand with just your wrist. Push down. Great. I'm going to come over here. Feel me touch here, and then go ahead and push up. Push down. All right. Now make a fist and push up, down. All right, very good. Can you squeeze my hands as tight as you can? All right, very good. Equal strength, +5 muscle strength on all upper extremities. All right, next up, we're going to be assessing your hip strength. So I'm going to have you push up on my hand. Okay, now push down. All right, very good. Push up, down. Okay, now I'm going to have you bend your leg out against resistance. Now push it in. Very good. Out, in. Okay. Now I'm going to assess your abductor and adductor muscles. So go ahead and push in, push out. All right, very good strength there. Next up, I'm going to have you do a plantar and dorsiflexion. So this is like you're pushing on a gas pedal and then pulling up. Push down as hard as you can, pull up. All right, equal muscle strength throughout, +5 muscle strength on all extremities. Very good. All right, next up, we are going to kind of do some sensory testing, making sure you can feel okay. So can you feel the difference between this before we start? That's sharp, that's dull. Okay, go ahead and close your eyes, and I want you to tell me whether it's sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull.
Go ahead and uncross your hands for me.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
All right, very good. All right. Next up, I'm going to do a test where I'm going to squeeze your big toe, and I'm going to lift it up and down, and then I'm going to stop, and I want you to tell me where it's at with you closing your eyes, okay?
Up. Down.
All right, very good. And then I have a vibration tool. I'm going to have you open your eyes back up just for a moment, and then I'm going to have you set your hands there, and then I'm going to have you close your eyes, and I want you to tell me when the vibration starts and stops.
Start. Stop. Start. Stop. Start. Stop. Start. Stop.
Okay, very good. Next, I'm going to put an object in your hand, and I want you to tell me what it is with your eyes closed.
Pencil.
Okay, great. Next up, you can open up your eyes, and I'm going to draw a figure in your hand, so then I'll also have you close your eyes for that. It's going to be a number.
7. 1.
All right, very good. Next up, I'm going to take 2 cotton swabs, and I'm going to kind of make sure that you can feel both points of pressure. So if you turn your palms upward, this is 1, this is 2.
Okay.
Okay? All right, go ahead and close your eyes.
2. 1. 1. 2. 2. 2. 1. 2. 1. 2.
All right, very good. Good feeling and pressure points there. Lastly, I'm going to have you close your eyes, and I'm going to point to an area on your body, and I want you to point back to where it's touching, okay? All right, very good. All right, now we're going to just test some meningeal signs. This just can help us kind of rule out any form of meningitis or anything like that. So I'm going to have you lay back into a flat position on your back. Okay, and now I'm going to have you tilt your chin in towards your chest. I'm going to help. Okay, I don't see any hip flexion or anything like that, so that would be a negative Brzezinski sign. Next up, I'm going to kind of bend your leg up and then kind of lower it back down. Let me know if it causes you any pain. All right, no resistance on extension. All right, that would be a negative Koenig sign. All right, next up, this is just going to check any sort of lower back pain, so I'm going to do a straight leg raise. I'm going to assist you here. Does that hurt at all?
No.
All right, and then I'm going to kind of flex your foot here. Does that hurt?
Nope.
Okay, and then I'm going to do the same thing on this side. Does that hurt at all?
Nope.
Okay. Does that hurt?
Nope.
All right, and then the next thing I am going to check is your cranial, not your cranial nerves, your reflexes here. Right, and then I'm going to have you kind of just leave your feet there. I'm going to do this. Okay. All right, very good. And I'm going to help you sit up to a sitting position. You can go ahead and scooch forward a bit. All right, this is the last part of the meningeal exam, so I'm going to have you put your hand forward and see if there's any flapping. There's nothing there. Negative for asterixis on the left side. All right, negative for asterixis on the right side. Okay, very good. Next up, we are going to do your deep tendon reflexes. So I'm first going to start with the bicep here. Okay. Okay. Now I'm going to kind of flex your arm here, just relax a bit. Okay. Tricep. And then to the bicep. Kind of relax your arm. Okay. Okay, flex your tricep. Okay. All right, now I'm going to just have you scoot back just slightly. I'm going to do your knee reflexes. Okay. An ankle. An ankle. All right. All right, that concludes my neurological exam for the day. Thank you very much for participating. Let me know if you have any thoughts or questions. Thank you very much.